Hi, my name is Jason. I'm going to be helping you with suction on your tracheostomy. I just wanted to make sure that you're the person that I think you are, and I'm going to verify that the doctor's order is for you. And can I get your name and date of birth? All right, correct. And so we're going to be I'm going to be hyper oxygenating you so that you're not experiencing too much trouble breathing during this, because I am going to be putting a tube inside your tracheostomy and then sucking out any kind of mucus or fluids that ought not be there. And so yeah, just by having something in that airway can obstruct your, could it'll make a difference. It'll hinder your breathing a little bit. So I want to make sure you've got a lot of oxygen. So before I actually get started with that, I'm going to do some hand hygiene. I'm going to get all my supplies, and I'll come back and I'll evaluate you. I'll make sure I help you keep your modesty, and I'll evaluate you to get a baseline on where you're at. All right, I'm going to have to get your respirations, your lung sounds, your heart rate, and your O2 stats. So, and I'll be monitoring your O2 stats throughout, just to make sure you're doing okay. All right, so I'm going to do some hand hygiene. All right, hand hygiene and hand sanitizer. I'm going to go ahead and put on some gloves and okay. So I'm going to bring you up to a good height for me, just because I'm, I guess, above average height maybe, and I don't want to hurt my back. All right, and so I'm going to put the SpO2 monitor on your finger. All right, I'll be watching that, and now I'm going to listen to your lung sounds. There it is. All right. Can I get you to take a deep breath? And deep breath. Deep breath. And deep breath. Deep breath. Deep breath. Okay, going to deep breath. And deep breath. All right. You do sound like you have a little bit of fluid down there, and that makes sense because the doctor ordered that I suck that fluid out of there. And so what I'm going to do is I'm going to, before I really get started, I want to put this towel over you and try to make sure that the oxygen stays over you. I'm going to turn up your oxygen levels. I'm going to turn that up so that I'll hyperoxygenate you. I'm also going to turn on the suction and check that. So I'll turn that, make sure that this is got negative pressure. All right, it does. All right, and I would set that between 80 and 20, and not to go over 150. And now I'm going to take off my gloves and put on some sterile gloves, perform hand hygiene, sterile gloves, and get all my stuff ready. All right. So I'll go ahead and put that in the trash, hand hygiene. All right, and I'm also going to, at this time, I'm going to put on my mask. Put on my mask. Put on my goggles. And I'll get on my sterile gloves in just a moment. All right, so I've already hand sanitized, but I'll sanitize again. And I'll put this over here, and I'm gonna go ahead and open this away from myself using sterile technique. And I'm gonna go ahead and right on the top is the reservoir that I'm going to need. And I will, with the label in my palm, pour water into it. All right, I'll bring that forward. And then I'll get that out of the way. I'm also going to get my gloves. Okay, so I'm going to get that to stay open. All right, so I'm going to put this on my dominant hand first without touching the outside of the glove. All right, and then I will grab this and I'll look at your oxygen stats. Oh, you're at 120%. Good job. All right. Not really. That is not mathematically possible. All right, and next what I'm going to do is I'm going to, with the suction is already in place, I'm going to get this out here. I'll wrap this around my dominant hand. My non-dominant hand to connect this. All right, now what I'm going to do is I'm going to be putting this down there fairly quickly, just because I don't want to obstruct your airway too long. So I'm going to put it down until I meet resistance, and then when I come back up, I'm going to then come up 1 to 2 centimeters, and then over the course of about 10 seconds. I'm going to be pulling it up, and you may hear because I'll be intermittently sucking, okay? So if you've never had this done before, I just don't want you to be, don't want it to startle you. All right, so oxygen saturation, 100%. I'm gonna move this, and I'm going to go down. All right, resistance, back 1 to 2 centimeters, and I'm gonna go 3, 4, oh, that was pretty quick. Yeah, I don't know if I was counting right. But anyway, so I'm gonna put this back on you, and I'm gonna give you 60 seconds, and at this time, I'm also going to, I'm gonna suction a little bit of water to clean up the tube. I'm realizing I didn't do this beforehand, but I would have made sure that it can suck. So, but anyway, 60 seconds goes by. I'm going to do the same thing again once I know that your oxygen saturation levels are good. So I'm going to do this one more time. All right, here we go. All right, so now I'm going to replace this and wrap this up, put this in my glove. I'm going to keep your oxygen maxed out for at least 60 seconds, and put that in one glove, put it in the other glove as well. I can chuck that, and I'll put on some, I'll hand sanitize, put on clean gloves, and I'm going to assess you again and make sure your lung sounds are, or see what your lung sounds are like, and I'll document all that. And so you're at 100%. So I'm going to turn this back to normal, and I'll see what your lung sounds are at, or what they're like. Check your respirations, your heart rate, and everything. According to your SpO2 monitor, your heart rate's doing just like it was before. All right. Okay, I'm just going to move this towel. Deep breath. 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 And deep breath. All right. You sound much better than you did earlier. All right, well then I'm going to go ahead and I'll get all of this stuff off of you, and I'll clean up the area. I'll throw away all the garbage that needs to be thrown away. I'll get these gloves off, do some hand sanitizing, document everything. I'm going to put you back down to a comfortable working, or a comfortable height, so just in case if ever you did fall off, you fall from a lesser height. And here's your call light if you need me, or my CNA for anything, just give us a ring. But I push in this button right here. And then, yeah, and I'm going to go document all that and make sure this is all clean.